range. His blood pressure was 120/60, heart rate 70, respirations 18, pulse ox 100, and temp 98.6, and he was in normal sinus rhythm. The patient's skin is appropriate for ethnicity. It is uniform in color, smooth, warm, dry to touch. He does not have any wounds, no healing scars or anything like that, no lumps. I'll continue to assess the skin as I assess the rest of your body. I'm going to assess your head. According to the size, shape, symmetry, it looks normal cephalic. Your scalp is pink, dry, no lesions, free of parasites. Hair is light brown, evenly distributed, coarse. Your skin is uniform in color. Your facial features are symmetrical. Okay. Could you close your eyes for me? I'm going to assess the cranial nerve, trigeminal cranial nerve 5. Could you tell me where I'm touching your face?
Right cheek, left cheek, forehead, chin.
Okay. And could you clench your teeth tight for me? Okay. Patient clenches his teeth tight bilaterally. Okay. Could you smile big for me? Show your teeth. Okay. Great. Patient's smile is equal bilaterally. So cranial nerve 7 is intact as well. Could you close your eyes and resist me opening them? Great. Okay. Check your nails. Okay. Nails are convex, trim, translucent, no clubbing, less than a 160-degree angle. Capillary refill is less than 3 seconds. And I've checked both bilaterally. Eyelashes are everted. Eyebrows are present, symmetrical, coarse. Okay. Now we're going to check your eyes with the Snellen test. Approximately 20 feet away. Could you close one eye, please? Okay. Read this line.
G-O-Z.
And could you tell me this color?
Red.
Could you cover the other eye, please?
L-P-E-D.
Show me this color.
Green.
Okay, both eyes. Could you read this line?
P-E-C-F-D.
Great, thanks. Okay. Okay, now I'm gonna test cranial nerve 3, 4, and 6, the oculomotor, trochlear, and abducens. Could you raise your eyelids for me, please? Okay, could you follow my pen light? His pupils are equal, round, and reactive to light. If I was using an ophthalmoscope, I would check for the red reflections of the retina. I would identify the blood vessel and follow it to the optic disc. Identify the macula and the which is the temporal to the optic disc, and I would do the right and left eye. Okay, now I'm going to look at your ears. Make sure they're symmetrical, both elastic. Look in them. Okay, could you cover one ear for me, please? I'm going to whisper a word. You tell me what it is.
Jackie.
Okay, other one.
Chicken.
Okay. His cranial nerve 8. The acoustic is intact, as evidenced by he's able to hear the whispered word. Okay, and if if I was using an otoscope, I would inspect the external ear, check the tympanic membrane and note the color, check for any redness or anything like that. Okay, and I'm gonna look at your nose, make sure it's midline on your face. Feel his frontal and maxillary sinuses. Are you having any tenderness? No. Could you occlude one nostril and sniff for me? And occlude the other and sniff? The nares are patent. Olfactory, can you smell normal smells? Okay. Olfactory, cranial nerve 1 is intact. Lips are symmetrical. They're pink, moist, without cracking. Can you open your mouth for me? Get onto your first here. Okay. The buccal mucosa is uniformly pink, smooth, moist, and without lesions. The teeth are all present and white. Gingivae are pink and without edema, no bleeding, no lesions. Okay. The hard and soft palate, upper and lower palate are continuous and smooth without lesions. Hard palate is white. Soft palate is pink and smooth. Pharynx, the tonsils are not present. They're pink, there's no swelling. Tonsils are a grade of 1. The uvula is midline and rises and falls. Can you open your mouth and say ah? Okay. Now I need to check your gag reflex. And you have one. Okay. The cranial nerves 9 and 10, glossopharyngeal and vagus cranial nerve 10 are intact. I tested those together. The uvula and soft palate move straight up. The tongue is pink and smooth. Ventral surface is smooth. Okay. Can you stick your tongue out for me? Straight out. Okay. Cranial nerve 12, the hypoglossal cranial nerve, is intact. Okay. And your neck, can you move your neck side to side, front to back? Okay. How about to resistance? Okay. The cranial nerve 11, the spinal accessory cranial nerve is intact because it moves against resistance. Okay, lymph nodes, palpate your lymph nodes. Okay, I'm gonna palpate the occipital, posterior auricular, preauricular, tonsillar, submandibular, submental, superficial, cervical, posterior, and deep cervical. And lymph nodes are not palpable. Okay, now I'm going to palpate your carotid arteries one at a time. Listen with my stethoscope. And there's no sign of a bruising. Okay. Now I need to listen to your lungs. Could So the lungs and thorax, I'm gonna assess the skin. Skin is smooth, no lesions, lumps, or anything. I'm gonna listen to the lungs in 6 points. Take deep breaths. Percuss. Check your skin turgor. That's good skin turgor. Okay, breath sounds were clear bilaterally with no adventitious breath sounds. Okay, instead of performing a breast exam, I'm just gonna voice how it would be done. I'm gonna have you set the 3 positions that you would set for a breast exam. Could you hold your arms up like this? And now hold them like this. And now on your hips. Okay, those are the 3 positions for a breast exam. The skin color is continuous with the rest of the thorax. There's no increased vascularity, striae, or lesions. The areola are inverted and darker than the rest of the skin. The breasts are symmetrical, no masses, edema, or dimpling. There are no changes in the symmetry with 3 position changes. And I'm gonna palpate the lateral, central, posterior, and anterior axillary nodes. And no nodes are palpable. There's no tenderness and no discharge. Okay. So now for the cardiovascular system, there are no pulsations, lifts, or heaves visible over the precordium. So I'm going to find the landmarks. You got the aortic, pulmonic, Erb's point, tricuspid, and the mitral. I'm going to listen to all these points. Point of maximal impulse is palpable but not bounding. The rhythm is regular with no extra sounds or murmurs. Okay. And as far as the peripheral vascular goes, the patient shows no cyanosis. Hands and feet are warm to the touch evenly, bilaterally. The color is symmetrical, hair is symmetrical. The brachial and radial pulses are even. Tibial and pedal pulses are even with a regular rhythm and rate. Capillary refill is less than 3 seconds. There's no edema present. Okay, now I'm going to determine the patient's level of consciousness.